All right, Ronak, the red light just came on. A lot of people bail right now because they get real nervous. How are you feeling? You want to go forward?
I'm feeling good. Let's do it.
He's going forward. All right, everybody, let's jump into it. Well, why don't we do me a favor? Why don't you tell my listeners who you are, what your company is, and what you guys do?
Sure. My name is Ronak Vyas. I'm the CEO and co-founder of MedCoShare. MedCoShare is a Philadelphia-based medical co-working space and services company. We started in 2020, have expanded since then, so up to 4 locations in 3 different states, and yeah, looking to do a lot more.
What's cool? Let's talk a little bit about, back in 2020, what was the problem that you really saw in healthcare that made you want to start this venture? Like what was the main problem that you wanted to try to solve?
Yeah, so prior to me launching this with a few partners of mine, I was a commercial real estate broker and I was representing tenants when they were looking for medical space.
Hmm.
So think of small practices, typically 1 or 2 docs in the group. And in Philadelphia, and I think this is a problem just nationally as well, it's really tough to find a small amount of space. And by small, I mean less than 2,000, especially on a short term basis.
Hmm.
Most landlords, they want to do long term leases. They want you to lease out more square footage than you really need. And that's completely the opposite of what these doctors need, what these practices need. So we figured out if we could be the middle person and kind of bridge the gap between what the landlord and the
Hmm.
tenant wanted, we thought
Hmm.
we'd had a pretty good business case for that. So on the landlord side, we're willing to sign the 10-year leases. We're willing to take larger spaces. And then on the uh, practices side, we're able to provide a flexible membership model where doctors can rent month to month. They can rent one room or multiple rooms. So it's the most, I think, cost efficient, flexible way for doctors to start, grow their practice, and also open a satellite location if they want to.
Yeah, that's great. So what's a first step that you take in the building world here, right? What is step one in your adventure here?
The step one would be to find a good location
Hmm.
because that's critical,
Yeah.
right? That's not something that you can change. You can change a lot of things in the business once it's running, but you can't really change the site location other than giving up on the lease and
Hmm.
moving out completely and losing that money. Um, so when we choose a site, it has to make sense for the patients. Right. So are they being underserved in that area? What are the competitors like in terms of what other doctors and hospitals and clinics are in the area? What's the, as simple as what's the patient demographic in terms of household income?
Hmm.
What type of insurance do they have? Is it Medicare, Medicaid, private? Is it no insurance? So understanding where you are geographically and then finding the right building to be in. That's critical step one.
Yeah. And what does your, I guess, the business model look like day to day in your world? What is this co-working model look like?
Yeah, so we've refined it over the years. So what we do now is we have a scheduling system which allows the doctors to book their times on our backend portal, and then basically once they do that, it gives them the room that they're going to be in for that day. If they're a part-time member, if they're a full-time member, they get 24/7 access, so that's a little bit different.
Mhm.
But for the part-time members, they log in, they schedule their session, and then us, the MedCoShare team, we're notified of who's going, when, and where. Right. So the front desk admins, they'll get a daily email first thing in the morning saying, okay, so and so doctor is going to be in room number 5, right? And then in the afternoon, it's going to be utilized by this different doctor. So we'll get the schedule and we'll basically handle anything that comes out throughout the day. So if patients come in, they're confused, they don't know if they're in the right spot,
Mhm.
would assist with that. Let's say the doctors need something, so we're there to assist the members. And if they have any issues with the space, or maybe they need to utilize the room a little bit longer, whatever it is, we're there for them.
Wow, wow. Yeah, so that's a lot. So how are you balancing being a real estate company as well as sort of operational support for doctors' offices? I mean, those are those are those are two companies in its own right. So how are you walking this fine line of balancing your time and
Yeah, no,
energy?
no, no balancing. You just keep, you just keep going. You just keep working,
Yeah.
right? So yeah, it is really two different companies because you have the real estate portion that you're like the property managers of, and then you have the services side, which is basically the support services we provide to the private practices to our members. So that could be anywhere from marketing support to helping with billing and scheduling, providing resources for credentialing. So we want to make it a one-stop shop for these private practices to get started with us and grow.
And do you have on the operational doctor side, is it a type of doctor? Is it anybody could do it? Is there so I guess is there a focus to who really would benefit the most from what you're doing?
Yeah, Jeff, that's a really good question. When we started the company, we had no idea who was going to be, the ideal kind of d- demographic
Yeah.
in terms of the specialties and who's going to come in. We assumed that it would be more of like the entry level care. So, like, you think of primary care,
Hmm.
right? Um, we thought we would have more of those, but it's actually, we get a lot of demand from surgeons, and what they do is they utilize it for pre and post care. They utilize it for satellite locations. They could even use it for minor surgical procedures, and it makes a lot of sense for them. So we have a wide mix. We have dermatologists, ENTs, cardiologists, primary care. We have NPs that want to go on their own and start their own clinic. Oftentimes they'll do like weight loss or Botox treatments. But yeah, we have 108 different members, 108 different practices under our four locations.
Well, how do you service the equipment for all of the different ways that you just described? Like how are you outfitting the locations with, I guess, the gear needed, for the
Yeah,
different types of doctors?
right. So it's different equipment for everyone.
Hmm.
What we do is we provide a turnkey room, which essentially includes an exam table, and then simple things like gloves to just make it ready for primary care.
Gotcha.
Then, if obviously if they're a specialist, they're going to have different equipment, supplies that they need. Maybe they don't need our exam table at all, and they need something to put in their own like specialized furniture. So, for
Hmm.
example, the ENTs brought in their own furniture. So when you take a full time room, it's fully customizable.
Hmm.
So you can take our stuff out and do whatever you need to make it work for yourself. So it's really a flexible model. We want to keep it basically provide the basics, but then have room for these differences that you'll have amongst the different specialties.
Yeah. Have you? What are the misconceptions you've heard? Maybe people say that you have found yourself having to constantly kind of go back and go, no, no, not quite like that, or have you found like, all right, people think of it this way, but kind of, what are you saying over and over to just to make sure people really understand what you're doing?
Yeah. So before we got this is the We Work for Medical,
Hmm.
right?
Yeah.
And it's really not. You know, it's not a lot of open areas. It's not a massive facility of like 40,000 square feet.
Mm.
Obviously, we want the doctors to refer patients to each other, but it's very different than the general co-working model, right? Because it's specialized for healthcare.
Yeah.
So when you do that, you have to keep the patients in mind. Their privacy is, the utmost importance. So you have to do things where you're essentially running a clinic, but the look and feel should be a little bit more elevated.
Mm.
So we like all our locations to kind of look like a med spa, and then we operate the clinic right and the best way we can. But the most important thing is that the patient should feel comfortable, and that the doctor should have a good place to work.
Yeah. How do you measure KPIs in this business? If somebody were to ask you, you know, hey, you grew. What does that? Is new buildings? Excuse me, new properties, more doctors in, more patients. Just walk us through your KPIs in your world.
Yeah, so it's going to be revenue, number of memberships, right? So those
Hmm.
are the two big ones. The occupancy.
Hmm.
So you can get 100% occupancy if you're charging a really low amount. So that's not the goal,
Right.
right? So it has to be a good balance of like, what are you charging along with the occupancy? So that's important. Um, Member retention, that's a big one
Mm.
because that indicates whether it works for them, whether they're satisfied with it, whether it even works for their patients. So our member retention is pretty high, and we're happy about that. So those are like the main ones that we track. There are a few smaller ones,
Yeah.
but for the most part, there's 3 or 4 buckets that we need to follow.
Gotcha. Kind of moving over to just maybe provider experience. From your perspective, from where you sit, like, what's the hardest part in today's world of being a private medical practice? Like, what is the hardest part about it in your mind?
I think it's different in different parts of the country, right?
Mm.
So it's different challenges in a rural area versus challenges in an urban area. We're more familiar with the urban model, right?
Mm.
We're based in Philadelphia and we have locations nearby. I think some of the challenges is that these practices they're going to compete against major hospital groups, right? In a place like Philadelphia, where you have Jefferson, you have Penn Medicine, you have Temple Health, and then all the kind of offshoots from that. So it's quite a bit of docs and practices. So
Mm.
when you're private, you got to do a little bit more marketing. You have to be more out there, and patients need to become familiar with you. So branding is critical.
Yeah.
One of the things that happens with these larger hospitals is that the wait time for specialists is really long.
Mm.
And when you're private, you don't necessarily have to deal with that. You can open up for more hours if you want to, right? So it's different. The challenges, are it's challenging on both sides, right? Because on the hospital side, there's like physician burnout. You're constantly being told what to do, and it's just basically economics game.
Mm.
But in private practice, you're not going to have the brand recognition that Penn Medicine does.
Right.
So pros and cons for each one. But my theory is that there's going to be more private practices opening over the next decade
Mm.
than ever before, because I think there's a lot of unsatisfied physicians.
Yeah. Yeah. Interesting. What, talk us to a little bit about sort of any feedback that you've gotten from doctors at this point. I mean, you are out, you exist. The idea is out, being executed. What kind of feedback have you been getting so far?
A lot of positive feedback. I think the docs appreciate having a platform where they can get started easily, right? They can get started with us in less than 30 days. Because medical co-working, it's a very new sort of concept. Even though, people have been doing it for, over 10 years now,
Mm-hmm.
it's not, it's not on the forefront of people's minds, right? For patients' minds, they're still
Yeah.
very used to the old ways of doing things. And the same thing with the doctors. They're used to how things have always been done. But I would say that, it's a lot of positive feedback that we got from the docs, and a lot of people appreciate that we've opened, and they ask us to open more locations all the time
Mm.
in different states and different markets.
Mm.
So we're very bullish on it. I think the demand
Yeah.
is there.
It's a good segue to my next question. My next question was,
Right.
all about, you're already in multiple states, but what is the vision of scaling MedCare Show nationwide? Like, what does that look like, and how is that even achievable as of right now?
Yeah. So we want to be the first national medical co-working company. There's a lot of regional players, but nobody's national.
Mm.
So we want to be number one. We want to have the most amount of locations, and we want to have locations in areas where it's needed and it makes sense, right? So our goal is to have a minimum of 100 locations. And now you got to backtrack and say, okay, well, how do you get there?
Mm.
One way is we can raise capital and start opening ourselves. Another way is start partnering with the landlords and do a revenue share model. So that's kind of popular with other co-working companies. The third way is franchising, right? So multiple different strategies to get to that end goal. And what we decide to do, a lot of it's going to be based on the amount of capital that we raise.
Right, right. When you're thinking about that next location, are there 3 or 4 criteria that you just need to check those boxes first? That you kind of think in your mind?
Yeah, absolutely. So patient demographics, very important.
Mm-hmm.
What's the economics of the site? Are you in a really expensive market where the cost per square foot is $100 a square foot, or is it more doable like $20 a square foot? Because you got to make sure that your margins are there. So that's very important as well. So what kind of deal you're getting? What's the cost going in? Because once you get going, you're going to have a set amount of fixed costs. So that's important to keep it as low as possible. And then just do a sort of competitor analysis. What's in the area already?
Mm-hmm.
I mean, if you open this, what type of doctors are going to want to come?
Right.
If there's 20 chiropractors in the area, are you really going to attract another chiropractor?
Mm-hmm.
Right. So yeah, it's a mix of things. There's no perfect model because everything is, very localized.
Mm-hmm.
But you try to make the best decision with kind of that data that you assemble.
Yeah. How do you, if somebody asks you who your competitor is, how do you answer that? It feels like there could be a couple different, maybe it's not a WeWork, right? So who is the competitor in this space in your mind?
Yeah. So, you know, there aren't too many direct competitors,
Yeah.
right? Because it's a small industry, but there's a ton of indirect competition.
Mm-hmm.
So I can just give you a couple of examples, but one would be, you know, generally if if an office building has excess rooms, that doc or the owner of that space might want to sublease one or two rooms. It's a very informal arrangement, but many docs that don't want to pay the full expense of having their own lease or buy the building will try to find a peer where they can go to and just sublease the space.
Right.
So that's very common. That's been done for ages, and you can do that in any market across the U.S.
Mm-hmm.
So I would say like that's our biggest competitor is how do you convince them that we have a better model versus just subleasing one or two rooms or even more rooms
Right.
from somewhere else.
Oh, interesting. Yeah, I didn't think about it that way, but I could definitely see like I've got 6 rooms, I need 3. Somebody come and take the other 3.
Right.
So right now you are out raising capital. I guess how are you talking about this and pitching this to investors right now? What's sort of the one-liners? How do you start the conversations with potential investors?
Very good question. So, we've crossed 1 million in ARR. We are cash flow positive. When you open a new location, it obviously dips,
Mm-hmm.
but usually once it's stabilized, you're cash flow positive again. We've been around for 5 years, so it's not a new concept. We're not trying to, do like a proof of concept. We know that it works. And we're looking to get a healthy return for investors within 3 to 5 years.
Yeah.
There's an exit path to this. We're aware of what those exits are. So it's just a matter of getting there in terms of revenue and in terms of like just maturing as a company. I follow other kind of players in the country, and some of them have already been approached by private equity. So we know like if you grow to a certain size, that's an opportunity.
Yeah.
So for investors, I think it's the right time. I think it's a great time. It's not like we're early on and we're just testing the idea, and our valuation isn't super high because we're not there in terms of where we need to be in terms of locations and revenue. I think we're going to get there, but I think it would be a great time to get in and see an exit within 3 to 5 years.
Yeah. Moving over to sort of leadership and vision for yourself, like what's been the most difficult leadership lesson that you've learned while building MedCoShare?
Yeah. So with MedCoShare, I would say what's the hardest thing as an entrepreneur is that you're constantly facing new challenges where you might not have the experience or expertise to solve, right?
Mm-hmm.
And just because you're the CEO, it doesn't mean anything, right? Like it's great, but that doesn't mean you have the answers to everything.
Yeah.
And when you're, a smaller company, you don't have the resources to hire expensive consultants or to hire really top talent where, they can solve these problems for you. So you're learning as you go. But I feel like if you're, willing to work hard, and you're willing to face those challenges, and you're willing to like take risks and try to come up with, logical solutions, I think that'll take you pretty far.
Yeah. And and so where you are sitting right now, what does your next 5 to 10 years look like? Where do you see, pitfalls happening, growth happening, the industry potentially changing, whatever AI is doing to this space, adding
Yeah.
that sprinkle into all of this. So where do you just see 5 to 10 years from now, and where you're sitting, and how the company fits, all of that? Where do you see yourself?
Yeah. So I think 5 to 10 years from now, we will be national. I think that's, the vision, and I think we're going to get there. Um, in terms of where the industry is going, I think there's going to be a lot of people that would want to go private.
Hmm.
The healthcare industry is broken for many, and especially the docs that are burned out, and have lost, autonomy. They no longer have the job satisfaction that they used to. Um, More and more of them are going to look to a model like ours, and I think that's going to grow. I think the services revenue is going to grow because of that, because all of them will need support services, in one way or the other. In terms of AI, like I feel like that's going to make practices more efficient, because now there's companies that are helping so many different parts of the model, where once people start implementing it, it'll make their life easier.
Mm-hmm.
It'll make the practice more efficient, so the cost of running it will become lower and lower. So once you have that, and you're able to save money through us by not buying your own real estate or getting to a really large lease, it will become more attractive for practices to want to start, because there'll be more money in it, right? Versus right
Yeah.
now, a lot of them are getting squeezed, especially primary care.
Mm-hmm. Mm-hmm. Well, let's wrap this up. Where should people go to dive into your world, want to learn more, connect with you? Where should we send people?
Great question. So we have our website, medcoshare.com, medcoshare.com. And then we have an active WeFunder campaign. So it can be found on wefunder.com/medcoshare.
Awesome. Awesome. Well, I appreciate taking time out of your day. I've checked out the site multiple times here. Really got some interesting stuff going on. I think you're solving a huge, uh, you know, problem in this industry, and everything you talked about makes complete sense. So I appreciate you taking time out of your day. And if you are out there and you're listening, go ahead and jump over to those sites now that we talked about. And if you didn't hear it, go to the description below and click those links, and check out what Ronak is working on. Very cool stuff. Appreciate it. Thanks so much.
Thanks, Jeff. Take care.